So thank you so much for being here. If you don't know me, I'm Todd Ferguson. I'm the director of the Religion and Public Life Center at Rice. I'm also a sociologist on faculty there. And this year, we're trying to curate conversations about leading communities in the midst of change. And so many of you are leaders, and we're trying to have conversations with scholars and other practitioners about what is changing. And sometimes it feels like change is happening beneath our feet as we're walking with people. And so today, we are so excited to have two of the leading scholars on clergy well-being. So we know that, and you know, many of you are religious leaders. Being a religious leader can be hard, and taking care of your own well-being and also taking care of the well-being of other leaders around you can take a lot of effort. So I would love to introduce our guests today. So today we've got Regine Heschel-Bell. She is a community psychologist and research professor in global health at Duke University. She leads the Duke Clergy Health Initiative. And so that is by far like the most preeminent institute that looks at clergy health. She and her team collect amazing amounts of data, longitudinal data, specifically because of their location at Duke and the Duke Endowment with United Methodist clergy, but also it can expand to other groups. So she established that, it was established in 2007, and then she has created behavioral trials, clinical trials. One is called the Spirited Life Health Study, and then the Selah Stress Management Study. So trying to enact clinical improvements for pastors and other clergy. So the study that I was mentioning is the the Clergy Health Initiative longitudinal study, and 17 years of data. So, and with the Methodists in North Carolina, it's amazing because they can say, please take this survey, and they do. They're so generous. I'm saying that like I published out of this data as well, used it in my research. She is the author of Faithful and Fractured, Responding to the Clergy Health Crisis with Jason Biasi.
Biasi,
thank you.
a theologian and United Methodist pastor.
Former United Methodist, Canadian United Church pastor.
We are going to, our books did not arrive in time, but we're going to have a book giveaway. So 3 of these books, this is my copy. We're going to have 3 books that we'll randomly choose from the crowd, and we'll make sure we mail it to you. And then, so Regine resides with her husband in Durham, and their young adult children, and she loves finding joy in people. That's beautiful.
That is true.
Loves finding joy in people, birding, hiking, celebrating health. And she's working on a book currently titled How to Make Cancer Suck Less for You and Some. I love that. Regine and I have gotten to know each other professionally and worked with each other. She's got a heart of gold, really passionate, and then also on top of that, a rockstar scholar. And then we have David Eagle, also an amazing person. So David Eagle is an associate research professor in global health and sociology at Duke, and he conducts interdisciplinary research that intersects religion and health and social inequality. And so he's looked at clergy mental health and well-being, racial inequality in religious organizations, and then just looking at the sociology of modern congregations. He has won major awards. So 3 years ago, he won the Best Article Award for the Society of the Scientific Study of Religion. And he is the principal investigator, the main researcher for the Seminary to Early Ministry Study, looking at 10 years of longitudinal study about when people enter in seminary and what do they do afterwards. He earned his PhD from Duke, and then his theological education at Fresno Pacific Seminary and Duke Divinity School. So, David, thank you so much.
Thank you. Wonderful to be here.
Okay. So if we can welcome them. Okay. So our goal today is just to hear about their research. Like I said, these two scholars are like at the cutting edge of clergy well-being. It's true though.
Yes, it is. It's a small community, but yes, yeah.
Okay. Well, when you talk about, and I've written very few papers on clergy well-being, but you always cite Herschel Bell and Eagle. So, I mean, like, these are the people. So, I'm going to ask Ray Jean first. So, you spent the last 20 years studying the well-being of clergy. Can you talk to us about how clergy are doing?
Yeah, it occurred to me, like often when we talk or when I talk, it's only to clergy. And I'm told there are several clergy in the room here, but not exclusively. Can you raise your hand just so I have a sense of like how many people here are clergy with lived experience? Wow. Okay. Well, wonderful. That's great. So are people, right?
Yes, I know.
So glad to have the rest of you here too. So when I first started studying the well-being of clergy, I really knew very little about clergy and clergy life, and I had a lot of assumptions about what it might have been like. And then, in trying to study their well-being, I started from a place of learning more and more about how many of you spend your time, and I started to think, well, you must be pretty stressed. Like I started to think, well, it sounds to me like you're doing a little bit of everything, from supervising somebody in the church to trying to make meaning of the world, sometimes very challenging on Sunday, to like being called for some community activism or social justice, to counseling parishioners. It sounded like you were all over the place, and so I thought that might be pretty stressful. But I will say it was really wonderful when David joined the team. He pushed me on a lot of these things. He's like, well, a lot of people have careers where you do all kinds of different things. And yes, it's stressful to toggle back and forth between things, but clergy aren't the only ones. Okay, I'm going to try and figure out what clergy are the only ones to do. So he's like, and it's like, you're really busy and you're on call and it could be 24/7. And I'm like, well, there's other occupations where you're like, you don't have any backup and you're on call all the time. I'm like, okay, all right, there are. And then the counseling aspect and working with people who are going through grief and tragedies, and even sometimes like the joy or the feeling of a high after a really great sermon or connection or social justice. Like that can be really hard to go up and down, but other people have that too. All right, here's where I've landed that only clergy have, and you all can correct me on this or not, but I think that clergy often get criticized, something I did not realize before this work, that there's a lot of opinions. Like there's for every person in the congregation or in the pews, they might have a different job description for you. And then when you do something that deviates from that, then that's room for criticism. And there's also increasingly room for criticism around what you actually say in sermons. And the same people who criticize you can also be the ones that you just stayed up with all night in the hospital, and can be the same ones who you baptized their children and then did family counseling and saw people grow up. And it's those same people who you're performing these moments of like close connection, which is why people go into ministry. They very much want that. But that's also who evaluates you on a year-by-year basis, and who sets your salary, and so like politicians get criticized, but they go into it knowing they're going to be criticized, and then those aren't the people who are who they're providing social support and intimate counseling to. And I'm a psychologist. It's been a long time since I've done therapy, but like my clients weren't the ones who they could criticize me fairly, and but they also weren't the ones who like supervised me. Okay, so going into all of this, I wondered how clergy were. Like, how are clergy doing, knowing that this is some of their landscape? The other part of the landscape, of course, is that clergy are called. They really want to be doing this work. They come out on surveys as having like some of the highest satisfaction with their vocation. Like, you don't even want to call it an occupation. Like, this is their life calling. And so there's some real strengths in that meaning that come out. I started looking at physical health, and then we've been looking at physical health together. And David has this great study comparing obesity across clergy of different denominations, and all the data come from like 2019, 2020, so it's pre-pandemic. And the trajectory that physical health, as with obesity as a marker for clergy, had been on is clergy had been healthier before like 1970. There's all these studies of clergy around the world living longer than medical doctors, lawyers, and teachers, like the other revered occupations of the time. And then there was this period of time where the obesity rates for clergy went much higher, about the time that I put the word crisis in the title of my book, which publishers also want. Something ear catching, eye catching. And but now with this most recent study, it seems like clergy are doing all right. It seems like the American population has caught up in obesity to clergy. Not necessarily that clergy got better. And what we now know, I've been funded by the Duke Endowment. We've been partnering with, as well as studying, United Methodist clergy in North Carolina. And it turns out they have their own particular health challenges that are higher than other clergy groups. So it's really important to be paying attention to what denomination you're talking about, that there are certain denominations that have slightly lower than average obesity rates, and then there are others that are higher. So Black evangelical clergy, United Methodist clergy are higher than Americans, and then mainline Protestant clergy maybe are on par, and maybe Catholic priests are lower.
Yeah.
So that's a mouthful. I have more I can say about depression and mental health, but maybe I should stop for a second.
Okay. That's really great. That's really great. So, David, I want to talk to you. So, like me, you're a sociologist. So, I'd love to hear from your perspective. What are the broader social environments and factors that are affecting clergy that you're seeing from your research?
Yeah. First, thanks for having me here. It's just a joy to be here. Thanks for Elaine and Todd for arranging this, and it's great to be here. Really good question. And there's a few things going on, I think, in the broader social landscape that are having big effects on clergy. Some have to do with how religious affiliation is changing in America. And I don't think this will come as a surprise to most of you, but religious attendance has been declining steadily since the 1970s. In the US, this has been particularly pronounced in the mainline Protestant world and the white Catholic world, but starting to show up in the evangelical world as well. So, for instance, the United Methodist Church, when it was formed in 1968, had about 15 or so million members. Today, it has about 4 million members. Southern Baptist Church has witnessed a decline of about 25% of its membership over the last 25 years. So a lot of clergy live in a sense that that they are serving an organization that is declining, in some cases dying. And that living in a world where sort of resources are becoming more scarce, I think definitely has a major impact on clergy. You're sort of like, if any of you have read the Percy Jackson book, there's this great character of who comes back. He's this undead sailor who comes back, but he is a Blockbuster, a former Blockbuster store owner who was caught up in the streaming wars and died in the streaming wars. So I think sometimes pastors worry that they are like running a Blockbuster in Netflix age. So that's sort of a nice analogy for what I think.
I'm feeling it.
So I had to explain to my 13-year-old what a Blockbuster store was. Because he's only grown up with Netflix. So that is definitely one thing that is exerting a major impact. And then the second thing that is having a huge impact on clergy is our political environment. And there's some really compelling sociological research that shows that, in the mid part of the past century, for most Americans, they put their religious and sort of civic identities first. They saw themselves as Christians and as broadly as Americans first, and then as Democrats, Republicans, etc. later. One of the big things that's changed is that for a lot of Americans, their political identity, so whether they are Republican or Democrat or left or right leaning, has now become their primary identity, and their religious identity has become secondary. And so this has led to a situation where there's just a lot more conflict that pastors are dealing with in their congregations, and there's a lot more sorting that's going on in the population, where Democrats are going to liberal churches and Republicans are going to conservative churches, and the two are not talking to one another. However, in spite of that sort of sorting, one place where sorting actually hasn't been as strong in America as it has in other parts of life in this country is in churches. And so churches remain relatively politically diverse organizations. United Methodists are some of the most politically diverse organizations, but you see this across the spectrum in very liberal congregations and in very conservative congregations. You do have a mix. And churches are somewhat unique in the fact that you have people of very different political persuasions trying to build something together, trying to be a community together. But because people's political identities are so much more important to them, that it's harder for them to get along with each other. COVID just blew this out in the open, and I think what shocked a lot of people is that the person they sat to next to them in the pew for decades, all of a sudden, oh, they're an anti-masker. I had no idea, because we never really talked about this stuff, but that all of a sudden with COVID, you had to talk about your political values, and so pastors are caught in the middle of this and facing criticism, if they say the wrong thing from both sides. I know my own pastor, the kinds of things that are said to her by parishioners, they're pretty shocking in just how callous, unkind they are when she expresses a viewpoint that goes against one person or the others. And people are just much more willing in this age of social media to yell at each other without remembering that we are humans first, and opinions second. Yes. So yeah, those I think are the two big things that are going on socially.
One thing I do love about your research is it's not all doom and gloom. You actually enact positive measures. So, Regine, I would love for you to tell us about the Selah study. How did it come about, and what did you test out in the community, and then what did you find?
Oh, great. All right. So we had done a very large randomized controlled trial to try to improve physical health with clergy, specifically metabolic syndrome, and then also to improve depression symptoms. And so when we first started with the United Methodist, I did a careful study comparing their depression screener scores, not real diagnoses, but there was 10 or 11% who were screening as if they would have moderate depression or higher and should maybe go see someone to see if that's really true. And compared to nationally doing like a fair comparison, it was more like 5.5%. So there was this disparity here, and also is just concern for clergy and what could be done about this. And in the Spirited Life randomized controlled trial, we saw really good physical health outcomes, but we didn't see any improvement in depression symptoms on average. Like one pastor who had been depressed no longer would be, but a different pastor would now become depressed, and so it was all just averaging out. Oh my gosh! And I'm a psychologist, folks, so I'm like, this cannot stand. We've really got to work on this. Like something can be done. And I started looking at like our U.S. healthcare system, and so as you know, a lot of what happens is now, fortunately, you go to your primary care for anything. Maybe you get screened with a couple items. Maybe your provider there will refer you to a therapist, or maybe they'll prescribe medication if you're open to that. And a lot of times they'll prescribe medication once at like an appropriate starter level, but you won't necessarily come back after 2 to 3 weeks and get reassessed, when often people need to go up 1 or 2 times with like 2 or 3 weeks in between. And so it's left a lot of people in our country saying, oh, I've tried medicine and it doesn't work for me, because they weren't properly dosed. Also, with that system, you're only treating people who are already symptomatic. And I looked around at the literature, as like, you know, academics want to do. It's our best gift is to see what other people have already found out about something. And I stumbled across a paper that said like a national strategy for reducing depression in the United States. Okay, that is what I want to hear. And this was by a sociologist named Corey Keyes at Emory University. And he said you have to get people flourishing. You need to get them to positive mental health, and it will prevent depression in the first place. And suddenly the light bulbs went off. I know this is kind of obvious in hindsight, but honestly, I had gone a year or two going, oh, we just need to treat depression faster. But actually, if you want to drop, say, a depression rate or a rate of anything amongst the whole population, you've got to prevent it in the first place. So how do we prevent depression? So there's this concept, or I believe it to be true, of like positive mental health out there, which are things like having high levels of positive emotion, and 2 more things: good psychological and good social functioning. So good psychological functioning is things like having warm and trusting relationships, liking accepting yourself as a person, feeling like you're growing as a person, like you've got meaning in your life. That'd be good psychological functioning. Good social functioning is feeling like you belong to a community, at least one, that you're making a difference in society, that the way society works makes sense to you. Anyone struggling with that these days? And when you struggle with that, it takes a toll on your positive mental health. And so, but if you have high positive mental health, in studies before our own, although we've also replicated some of these, you like 5 and 10 years later, you're less likely to have a new physical health, chronic disease diagnosis, and you're less likely to have a new mental health diagnosis in the form of depression, anxiety, or panic disorder. So I got all excited. I was just like, this is just gold, right? Like, who doesn't want to do something that's going to help both your mental and physical health, going to prevent it in the first place? And maybe that's more fun than like trying to treat depression. Like, how do we get people toward flourishing? And so based on this, the Duke Endowment that had funded us for this physical health depression study said, okay, we're going to let you have another go at it with depression symptoms and also stress symptoms. Pastors were stressed. We had a lot to learn about stress. And we chose 3 different interventions to test. I'm only going to tell you about the 2 that we recommend. And so one of them was mindfulness-based stress reduction. We wanted to test kind of like the gold standard. And the other was the daily examine prayer practice. Who's heard of the daily examine? Okay, great. Right. Like maybe 2/3, but yeah, don't worry. I had not heard of it. A psychologist recommended it to me from Catholic University. So mindfulness-based stress reduction, just to say, these are practices like loving kindness meditation, mindful walking, there's like mindful yoga, there's awareness of breath, there's like scanning your body from top to bottom. All of these things make you focus on this moment. And you'll notice your mind wandering. Either you're thinking about something that happened, maybe that's bothering you, or you might be thinking about something that's coming up. And you just non-judgmentally go, oh, I am thinking about, I don't know, my flight tomorrow. And I just am, but I'm going to try and bring my thought right back now to my breath. It's frankly really hard. Much of you have probably tried it. It's frankly really hard, but if you can do that, it does have really good outcomes. And what we found was, compared to a waiting control group of clergy who said that they were willing to try mindfulness-based stress reduction, that the clergy who did, compared to the waiting clergy, had lower stress symptoms, lower anxiety symptoms, lower depression symptoms, and they had higher positive mental health symptoms. So there you go. Okay, phew. I'm redeemed. We've got like some we've been able to reduce stress and depression symptoms in clergy. But maybe you would expect that with mindfulness-based stress reduction, which has been so well tested. What about this prayer practice, like the daily examine prayer practice? Like, there aren't a lot of studies out there that have taken a structured prayer practice to try to see mental health outcomes. And I just thought, wow, wouldn't it be beautiful if a practice that's meant to bring you closer to God would also reduce your stress symptoms? And the daily examine only takes 10 or 12 minutes. It's easy to learn. There's like apps while you walk and books and all kinds of easy ways to do it. And we found that clergy liked it a lot and they would do it. So all those great outcomes that I told you about with mindfulness-based stress reduction occurred at 3 months. All right, the daily examine at 3 months was headed in the right direction, but it wasn't statistically significant with anything yet. But at 6 months, it was. So the lower anxiety, depression, and stress symptoms, and the higher positive mental health, and much higher spiritual well-being as well. So where we are with all of this is like, we found that clergy would do both of those about 80% of the days. For 6 months, we did text them every day and asked them if they had done it yesterday. And we asked for mindfulness-based stress reduction, how many minutes they had practiced it, if they had done a formal practice. And it was on average 28 minutes. And so there's other people's studies that suggest that that's enough for a good outcome. I think I mentioned clergy are busy. I wasn't sure that they would do that, but they did. Yeah, I know.
That's amazing.
I know. It's pretty exciting to have very concrete teachable tools.
Absolutely. And so part of that study, y'all collected physiological data, right? And so, David, would you talk about that? Like, what physiological data did y'all collect? And then, like, what did you learn about with the mindfulness?
Yeah. So measuring stress physiologically is a very complicated business, and you're either stuck with measuring cortisol levels, which vary throughout the day, and so in order to measure cortisol, you have to have people spit in a tube at very specific times, right when they wake up, 20 minutes after they wake up, and then a few more times, and then when they go to bed as well. So cortisol is very difficult to measure. This was during COVID when we were doing this, and so we couldn't bring people into the lab, so trying to do all this stuff remotely. So cortisol was out. we then latched onto something called heart rate variability, which many of you have Apple Watches, etc., that tell you your heart rate variability. The principle of heart rate variability is that when a person is really stressed, their nervous system's brake is always being gently pushed, and that means that your heart rate doesn't vary and doesn't fluctuate a whole lot, and so it gives you a sign that you're chronically stressed because your body is sort of always putting a little bit of a brake on your physiology, and that people who are less stressed, their heart rate will vary from minute to minute a bit, because your system isn't just lightly holding on the brakes. We all have cars, and you're always told don't just like cover the brake all the time. Get your foot fully off the pedal. It's that sort of idea. And so we used heart rate variability as a measure of how chronically stressed a person was. Heart rate variability does correlate with both mortality as well as with risk for stroke and heart attacks. So it is it's a clinically validated measure. So we gravitated to that, and it was something we could measure remotely. It's not easy if you ever want to measure heart rate variability in a study. I would recommend against it, but you have to. Okay, but yes, lots of data cleaning involved. But so we did this. For me, I'm a sociologist. I'm Canadian too, so I'm cynical and skeptical about most things for both of those reasons. And so I'm always a little bit suspicious when just survey-based measures improve in health trials, because everybody kind of knows what the intervention is supposed to do, and I worry that people cheat a little bit. Regine probably disagrees with me on this, but this was like one of my worries.
These are clergy.
Yes. Clergy don't cheat. So it's much harder to fudge your physio. You don't have conscious control over your physiology. So I was really, so for me, for me to sort of say something's really, really working would be to see improvements in both survey-based measures of like how depressed are you, how stressed are you, as well as physiological measures. That would really give me a lot of confidence. And with mindfulness-based stress reduction, we did see a significant improvement in heart rate variability amongst people who practiced it, which I found really, really encouraging. Mindfulness for me, I was very skeptical of mindfulness because it's so popular. It's mindful. There's mindful everything that you can do these days, and it's been very heavily marketed. But really, at the root of it, when John Kabat-Zinn developed this idea, this treatment for stress, his main observation was that as humans, especially as North Americans, we live on autopilot, and we are not aware of our bodies very much. We're not aware of what's going on emotionally very much. And mindfulness is based on the premise of trying to create some space between our thoughts and our actions and what we do with our body, and trying to give us, so rather than my kid does something that annoys me and I scream at them, give ourselves that time to my kid does something annoying, and then, I've now practiced the skill of mindfulness, so that rather than just reacting, I can say, okay, what's going on? Why am I getting annoyed at my kid spilling his milk at dinner? And how do I want to react in this moment? So it's creating a little bit of space for you to think about your actions. And so I think what did happen was that clergy learned to create a bit more of a space between their thoughts and their actions, which I imagine we have lots of pastors in the room. I was a pastor for 6 years, and there are lots of things that make you want to react as a pastor in good and bad ways. And I think this skill as a religious leader is a really, really critical one. Anyone who's in an interpersonally demanding job, having the skill of saying just that microsecond to pause and say, how do I want to react to this, rather than just reacting out of our a fight or flight kind of response is really powerful. So, I'm a really big advocate for MBSR. I think there's lots of really important stuff in that, and I really encourage pastors to do that. I think what I'd love to see more of is some Christian adaptations of this, especially amongst some more conservative clergy. They're like that because it is rooted in Buddhist philosophy and theology. Some Christian adaptations of this, I think, could be a really interesting way to increase the uptake of this practice amongst pastors. But yeah, so that's what we saw. Thanks for the question.
And so, where's your research headed? What's on the horizon for the Clergy Health Initiative?
Well, right. As you can tell, I love interventions. I love testing these, and I haven't tested one since that one wrapped up in 2022. So I mean, 4 years without one. If I could do one, I'm very interested in two areas: sleep and clergy marriages and partnerships. And so we did find in that study, we had a really good the gold standard sleep report measure, and there are now and so we saw that 60% of clergy who signed up for a stress management study had poor quality sleep. 60%, and it was during the pandemic. So I thought, well, okay, maybe, I mean, pandemic times, but we now know for other studies in North America during those same years of the pandemic saw about 40% of people having disrupted sleep. So there's a disparity there. And we have an ongoing shorter question in 2023 on these clergy surveys suggested over 40% of clergy having poor quality sleep. And we know that sleep affects your mental health and your physical health. Like, since I am concerned about obesity in the clergy that we work with, like, poor sleep can contribute to that. And it makes it harder for decision making. And for a lot of people, if you treat insomnia, depression will go away. And so this could be another way to get at it. So we've got a grant proposal under review right now, and like, fingers crossed that we get the green light to go to the next phase and see. The other thing that I'm really interested in is in clergy, like the spouse of clergy. So when I say clergy spouses, I know there are lots of couples where both are clergy. That's not actually what I'm talking about. I'm just talking about like whoever you're married to or partnered with, if you are clergy. And we do see in our data that it's very hard to be satisfied with ministry if your relationship is going poorly. And then we also see that when we ask clergy like a relationship, a marriage satisfaction measure, these are the United Methodist clergy in North Carolina, about 60% end up indicating that they're very happy. And 10 to 15% are very unhappy. And then there's everybody else is in between. And so and then we're starting to look at like, okay, well, what relates to that over time? So like, we looked at like 14 years of our data. So across 7 waves, what is strongly connected. And there's a lot of work things that are strongly connected. So if you have a lot of we call it occupational distress. There's a specific measure, but like ministry distress, too many demands on your time and being really criticized, like that relates to at future time point saying that that you're very unhappy in your marriage. And if you are in more of a toxic congregation where congregants are making ministry decisions for you without consulting you, and they come to you and they actually question whether you really are a person of faith. I'm talking like, these are pretty dire things. That really relates to actually you saying that your marriage satisfaction is worse. But it also goes the other way. If you're really satisfied with ministry, your marriage is better. And if you're feeling lots of support from congregants, your marriage is also better. And so I think like it's an untapped way to improve the health and well-being of clergy, to try to figure out ways to support for those of whom are married, which is very high in the United Methodist Church.
Mm-hmm.
Exciting.
Mm-hmm.
Well, what we want to do now is we want to take a few moments where you have conversations with people around you, and then we're going to gather back. So this is time if you need to go to the restroom or grab another refreshment, please do so, and then we're going to open up for Q&A.
Nice.
So
Very nice.
what I want you to do, get in groups of 3 to 4 and introduce yourself. And then I want you to talk about this question. What practices do you have that help you with your health? Whether that's mental health, physical health, spiritual health. What are the practices that you have in your life? So introduce yourself and then talk about that question. And I'll gather us back in a couple minutes.
It's actually, the criticisms is exactly why we chose the daily examine. Because, the daily examine walks you through these steps where, I described mindfulness-based stress reduction in detail without the daily examine. But it's just these 5 simple steps where you and they're different versions, but the one I know better is you thank God for the day, and you review the past 24 hours, and and then you pause on something that's coming up for you in the past 24 hours. And it could be something really pleasant or really unpleasant. And so this would be a time where if you were criticized and you're still carrying that with you, you're probably going to stay there. And so, and then as part of that prayer, you pray to God about it. And you pray for guidance on next steps. And it's a moment to ask, God, is this relevant to the work that we're doing, that I am doing with you, God? And if it is relevant, then maybe I should listen to that criticism. And if it's not relevant, well, then maybe we can just let that go. And then you thank God for the day. So that was one way. We do have a new resource called Loved and Cared For. It's 3 pages. It's written for congregants and not for the clergy themselves. That talks about how you can love and care for your pastor, your clergy person, and it does talk about when you have something difficult to say, how do you go about that? Maybe you take your clergy person out for coffee. Maybe you don't say it at the end of the sermon in front of other people. And so I do think it can come from both directions.
Would you share that resource with me and I can send it
Absolutely.
out?
It is on our website, okay. But I will share it with you specifically. But just so you all know, if you search for Duke Clergy Health Initiative, then our website will pop up, which is Clergy Research Religion Collaborative.
Yeah.
Okay.
It's a little clunky, but just search for Duke Clergy Health Initiative, and there's a resource tab. And under resource, they're all there, or you can also see for congregants, and that one is really for congregants. And if you can get anybody in your church to send it to the lay leaders, then you don't have to do it.
So definitely, a long-term trend in theological education is that fewer and fewer people are going to seminary to become pastors, and that more and more people are going to seminary for everything from self-improvement to community organizing to chaplaincy to nonprofit work, etc. It makes it's challenging running a seminary now because you're trying to serve people with who want to do this, that, and the other thing. So that is definitely one thing that's going on. It used to be the common wisdom and what was supported by research was that attrition among clergy was fairly low from seminary, even from seminary into ministry, and that certainly it was certainly lower than teaching, which has some of the highest attrition rates. However, I think post-COVID especially, and what we see in our data with seminary students, is that there are an increasing number of people who start in congregational ministry and within 2 or 3 years go on leave and probably are not going to remain in ministry. We've seen that in the Western North Carolina Conference, especially has seen a lot of younger pastors going on leave in much larger numbers than were expected. And the reasons for that, I think, are many and varied. Some of it has to do with the expectations that seminary students have going into church work, that they do think this is going to be like all rainbows and unicorns. And that, like, one thing that, universities are wonderfully accommodating places. If you have a learning disability, if you have trauma histories, you will get accommodations. If you have mental health problems, there are a myriad of services for you on campus. When you get into the local churches don't, they don't accommodate all those needs in the ways that universities do, and there aren't nearly as many services. Especially if you're a United Methodist pastor, your first appointment's probably going to be in a small rural community in North Carolina somewhere. And so there aren't those same resources. And so some of it is that, seminarians haven't been sort of prepared for that reality. And then others of it are, salaries definitely across the board. This is in the United Methodist, this is seen in the EPIC study data out of Hartford. But salaries have not kept up with inflation in any way, shape, or form. United Methodist in North Carolina just approved the first pay raise since COVID to minimum salaries. It was like 1.5% or 2.5% or something. And so the quality of the work has also become worse. And then one thing we did see in our data is that I'm sort of struck by one case where we did site visit of a pastor who'd been in his appointment for 2 years, and what he sort of found was, he was at Duke, he was living in Durham. It's a progressive place. He was a pretty progressive person. He was appointed to a church in Southern Virginia, not a super conservative area, but a more conservative area, and just feeling out of place. Like, where am I going to find my friends in this community? All that sort of stuff, and really wondering, is this job really for me, or should I think about becoming a community organizer and moving to Boston where my people are, feel like more like my people are. So again, that's sort of our political identities are so incredibly important to us that it is really hard for us to live in places where the majority of people are different from us politically. So we're seeing a lot of that as well. I think your point, it's really interesting, especially teaching public school versus pastoring. Wow. Yeah, that's that's a lot. But so one thing that I think is really an important point that you make is this question of monitoring clergy. And there are few denominations that do this well. And the one thing that we often find, so in the United Methodist system, they're district superintendents who serve as sort of the primary support person for pastors in their district. The problem that results is that pastors become very hesitant to share their challenges with their district superintendents because they're worried that if I share my problem, they're going to move me to Podunksville, North Carolina, and I kind of like where I am, or that this will somehow come back to punish me. So that supervisors and district superintendents are sort of in this dual role of being both your supervisor and your performance evaluator as well as your support person. So finding ways to build, I think, both mental health monitoring kinds of systems and sort of anonymous supportive relationships where clergy can go to people. So if you have a gambling addiction, you are probably not going to tell your district superintendent that this is a problem, but it's obviously a really major issue that needs to be confronted, but you're worried about getting disciplined in some significant way if you raise this stuff. So I think these are really important things, and definitely both conferences in North Carolina are wrestling with how do we either reimagine the role of district superintendents or create a parallel system where clergy can go their challenges. On the sort of like, are people using religion as therapy or spiritual practices as therapy? I tend to take a more positive view on this, in that our mental health system in this country and many countries is really, really terrible. And so I do think that there is a really important place for spiritual practices that where people can turn to them for help and healing, and that churches can offer that. However, there are hard edges to religion as well that we don't always want to soften as well. The prophets said hard things sometimes, and sometimes pastors and churches need to say hard things as well. And we can't just be purely therapeutic communities. But I do think there's really a huge amount of healing that can happen through spiritual practices that people are really searching for and not really finding elsewhere. Like, the most popular thing our church does that brings hundreds of community members in is a Tibetan sound bath that we do. Yes,
Our first one at our church last
it's
year.
unbelievable, the hunger that people have for contemplative spaces to deal with the chaos and the noise that they are dealing with in their everyday lives. Yeah.
We have daily exam and resources on our website, including a Lenten series for congregants. If you are interested, that was very popular with the United Methodists last year. We also did a loving kindness meditation series for Advent this year, and we did it last year during the political season. There's nothing like a little loving kindness. And so these are already packaged for you and for congregants. And so please do check out our website. Yeah.
Well, why don't we, when we send out our follow-up email, we will have these resources.
Awesome.
So we'll find those.
Thank you.
So before we thank our guests, I want to remind everyone our next meeting, our next gathering is virtual. So we're going to have Glenn Milstein from
Nice.
New York City. He's at the City College. He's a psychologist there. And he is one of the leading researchers at the forefront of how do religious leaders respond when there's a mental health crisis in your community. When your congregants has a mental health crisis, he's going to walk us through what are those steps. So that's going to be virtual. He's going to zoom in from New York. He is a wonderful person, and it's going to be an amazing conversation. And then our next one will be, so our next two are virtual. Ryan Burge, who is the leading, David, how would you describe it? Leading data visualization person with religion. And so he is tracking all the trends. And then we're going to finish our season in person with Elaine and Kirby.
Nice.
Kirby and Stefan, talking about interfaith leadership. Findings from their interfaith study about Houston, which is a diverse city.
Yeah.
So once again, hey, thank you so much.
Thank you, Todd.